Okay, so what does FAMA mean to me? Well, I think in my experience, FAMA has been an introduction to people and content and ideas. So I think in terms of people, being part of the FAMA community connects me to people who are interested in similar things, medical education, health professions education, and being able to share experiences and ideas with people, I think, is one of the more powerful aspects of the FAMA community. The content, I think, when you come to FAMA, you get exposed to, or you get given a lot of content, and from that you start developing new ideas. A lot of the content kind of fills gaps in your own knowledge, so you often get exposed to content that can help you with things that you're struggling with at home, or kind of even things that you didn't know that you didn't know. So you kind of see that there are maybe 5 different ways of assessing this one thing when you only knew about the one. So I think that that introduction to new content is also great. And then following on from that, and maybe more importantly, is the introduction to new ideas and new concepts. And I think the FAMA, the presentations, the faculty, the peers or your fellows, I think they introduce you to a range of new concepts that really deepen your understanding of medical and health professions education. So for me, that's what it's about. I think it's an introduction to people, content, ideas, different ways of thinking, different experiences. So I think that the FAMA community is great for that. The impact of FAMA on the development of Brazilian health professionals. Obviously my experience is mainly in South Africa, but I would imagine that it's the same in Brazil. I think that developing health professions in education, or health professionals in education, is kind of linking back to this previous idea of improved understanding, increased exposure to concepts. I think that as a health professional, one of my goals is to continue to improve my understanding of health professions education, and then have an impact on patient outcomes. So I think in terms of improving the way that we learn, we're going to go back and then go into our classrooms. We're going to be sharing these experiences with our students. Hopefully we're going to become better teachers because of our experiences with FAMA. And by having that impact on our students, or being able to make those changes for our students, they then go out with the possibility of increasing healthcare in the country. So I think that FAMA, even though it's a relatively small group of people, I think can have an enormous impact, because each one of us goes back to our own institutions and shares with colleagues, and hopefully changes teaching practices to improve learning. That kind of leads into the next question, which is the impact of FAMA on human resources for the health system. I think I've already kind of touched on that, but the idea is that I think we go back, and by helping our students to be better, stronger, better able to solve problems, maybe even better able to think on a kind of a larger frame of reference. I think that FAMA has the potential to have quite a significant impact on health systems, because each one of us goes back and interacts with so many people. In my experience, if I have 60 students graduating every year, and my FAMA experience helps me to improve the learning outcomes of those 60 students, each one of those 60 students then goes out and touches the lives of many patients. So I think that in that way, what I learn on FAMA, if I implement it, could potentially have an enormous impact on the health system.
Thank you.